like,
Mm-hmm.
okay, we'll talk about the spoil
Causes.
later. Okay. Okay, so let me start. You can mute yourself if you're unmuted, and then I'm gonna start with a slideshow. This is a slideshow. I'm just gonna start. Okay, so I'm gonna share a few of this slide. Then after that, I have some video that I'd like to share with you that sort of really summarizes shingles. So of course, it's called by the virus varicella zoster, which is the same virus that causes chickenpox. So after a person recovers from chickenpox, it lays dormant, inactive in the body, and it's later on due to age or immune system being compromised or due to stress, it's reactivates. So all of you, you're correct when you say it's related to older people. Yes, it's happen more often in older people. There are very few cases of young people having shingles, but it's mostly the elderly. So it's really more common than we think it is. About 1 in every 3 people in the United States will have shingles in their lifetime. That is a lot, right? 1 in 3 is a lot. If you had chickenpox, you had a higher risk for shingles. More than 99% of Americans born before 1980 had chickenpox, even if they don't remember it. As you get older, your risk for having shingles and serious complication increases. So that was said by some of you that responded. So also, let's take a look at what happens after shingles. So about 10 to 18% of people who have had shingles, they can develop nerve pain that can last for months or even years. So that is the worst part of it. It's not just the pain you have before you have the infection, the pain during it, and then, after that, you might have what they call post-herpetic neuralgia, PHN, and this is the most common complication of shingles. After the rash is gone, after similarly that the shingles is gone, you still have the pain, you know. So shingles can lead to serious complication involving the eye, including vision loss. Very rarely, shingles can lead to infection of the lungs. And if the virus, just like with chickenpox too, when people have chickenpox, if it goes into their eyes, into their nose, the virus can actually go in and cause infection of the lungs, or it could cause hearing problems. So the same thing, with this shingles. Okay. So let's look at the signs and the symptoms. The shingles, we know already, it was said, is very painful because it's along the nerve, and the rash might develop on one side of the face, one side of the body. The blister, the rash that contains blister, typically scab in about 10 to 7 days. It's going to scab. Within 2 weeks, it's fully healed. But those days are like really painful. So early signs may be you having this nerve very intense pain, tingling in the area where the rash will develop. It may happen several days before the rash develops. And people can also have a fever before the rash happens. So the rash most commonly occur in a single stripe. That's why the name shingles is actually related to, I think in Latin, something related to like belt, because of the way it's formed around the body. The rash can also occur on one side of the face, we said that earlier. Some of the other symptoms may be headache, chill, or stomach upset. Just some of the kind of feelings you have when you have some viral infection. So that may be what you get. So what are the cause and transmission? Once a person has chickenpox, as we said earlier, the virus stays in the body, and the virus can reactivate later in life and cause shingles. Most people who develop shingles only have it one time during their lifetime. So that's a good thing. There are cases of people having more than once, but when you have it one time, mostly you won't have it again. However, you can have shingles more than once. People who never have chickenpox or didn't get chickenpox vaccine can get infected with VCZV from someone who has had shingles. So you can get, even though shingles is not something that you can transmit shingles, but someone that has shingles, because it's the same virus that causes chickenpox. You can actually get the chickenpox from the person. People with chickenpox are more likely to spread the viral than people with shingles. Covering the shingles rash can lower the risk of spreading to others. To prevent the spreading, so in itself, the shingles itself doesn't spread, if I can explain it well, but what spread is actually the chickenpox virus. So you're not going to have the nerve pain if you contact chickenpox from somebody that has the shingles. So of course, it's important to cover the rash, avoid touching or scratching the rash, wash your hands often for at least 20 seconds, avoid contact with the following people until your rash, with the following people until the rash or the scab's over. That will be 7 to 10 days. So these are the people that really are at risk if they're exposed to chickenpox. Pregnant women who never had chickenpox or never got the vaccine, premature or low birth weight infant, people with immunocompromised system. So those are the people that we have to be careful with, people with HIV and things like that. So prevention and treatment. There's a vaccine for shingles. Thank God there is a vaccine for it. So it's important to get it. I actually got mine last month as I was preparing this. I said, you know what, I'm going to present on shingles. I said, you know what, let me go get my vaccine. So I got vaccinated last month, and then there's going to be 2 doses. So I got one 2 months after. I have to go and get the second one 2 months after, at least 2 months after I can get the second one. So these are the various kind of viral medication that can be taken to actually prevent, that to sort of help heal the shingles faster or reduce its exacerbation. You know, so these antiviral medicine are often prescribed. This medicine, they will shorten the length and the severity of the illness. As I said earlier, they work best when you take them as soon as possible. So when you have a rash that is really unnerving and having some kind of really deep nerve pain, you want to take it to the doctor right away. Go to urgent care to make sure that they can put you on antiviral if it's shingles. Don't just say, oh, this is another rash. But you will know because the pain will be very severe. Pain relief medication can also help with the pain that you feel, and it can be over the counter. A wet compress, calamine lotion, and warm oatmeal bath may also help to relieve the itchiness that you will feel. So for people 50 years and older, it is recommended to get 2 doses of the vaccine, as I said earlier, and also people that had 19 years older with weakened immune system, you know, they will need to get 2 doses of this vaccine. Okay, so I'm gonna stop sharing my screen and share a video with you. I have 2 videos to share with you from YouTube. So I'm gonna begin sharing them. Hold on 1 second. Business owner. Okay. Then animate. Okay, it's gonna be in a minute. I really like this video because it fully explains what I just shared with you, and it will share it, it will explain it in details. So let me find it. Okay, let's find it. Okay, there you go. And everyone see it.
Shingles, also known as herpes zoster, is a common condition characterized by nerve damage and a painful skin rash. It is caused by varicella zoster virus, the same virus that causes chickenpox. The first exposure to the virus, usually during childhood, leads to chickenpox. After the primary infection resolves, the virus moves to sensory ganglia of the spinal and cranial nerves, where it becomes inactive. The body's immunity against chickenpox suppresses viral replication, keeping it dormant for decades. Reactivation of the virus occurs when this immunity weakens and fails to contain the virus. This can happen as a result of aging, stress, or other diseases. Instead of another case of chickenpox, the reactivated virus causes shingles. It multiplies and spreads along the path of the infected nerve, resulting in damage and pain. The location of pain depends on the nerve that is affected. Because each spinal nerve supplies a specific area of the body called a dermatome, the patterns of pain follow the dermatome distribution. When a cranial nerve is infected, face pain results. As nerves come in pairs and usually only one is affected, the pain is typically limited to a small area on one side of the body. Shingles develops in 3 phases. Patients typically experience pain as the first symptom. The pain can be described as a stabbing pain, or a burning, numbness, or tingling sensation. The area is sensitive to touch. Depending on the location, the pain can sometimes be mistaken for a lung, heart, or kidney problem. Less common symptoms include fatigue, headache, and fever. A painful skin rash appears in phase 2, a few days after the pain. The rash starts as small red dots, which develop into fluid-filled blisters. As the blisters follow the nerve path, they form a stripe on one side of the body. The blisters eventually dry out and crust over. The healing occurs in phase 3, which may take several weeks. There's no cure for shingles, but it is usually self-limited and resolves on its own. However, possible complications can be severe. Some patients may continue to experience debilitating pain beyond rash healing, in a condition known as post-herpetic neuralgia, PHN. The chance of developing PHN increases with age. Shingles that occur on the face, neck, or scalp may lead to vision loss, hearing loss, or other neurological problems. If blisters aren't properly treated, bacterial skin infections may develop. Prompt treatment with antiviral medications can speed up healing and reduce risk of complications. Pain can be managed with pain relievers, cool bath, or cool compresses. The affected area must be kept clean and covered. Most people get shingles only once, but it is possible to get it more than once. Shingles can be effectively prevented with vaccines. It is not possible to catch shingles from someone else, but people with shingles may spread the virus to those who never had chickenpox or chickenpox vaccine, in which case the person will get chickenpox, not shingles.
Okay, I think that was really, really informative.
No living being.
Hold on 1 second. That was very, very informative. So I'm going to share one more that talks more specifically about, yes, I can share the slide with you. I'm going to talk more, let me click the other one. Hold on. Okay, I'm going to share it. Okay, it's about 3 minutes long.
Adult vaccination can be thought of as a cornerstone of successful aging, but a major issue hampering the uptake of shingles vaccination is the lack of awareness of the disease. Shingles is caused by a reactivation of the chickenpox virus later in life. After your body beats back chickenpox, the virus hides in waiting in your spinal cord, waiting for an opportunity to strike back. When it does, the virus can surge forth, traveling along the path of a nerve branching off the spinal cord, wrapping around one side of the body to the front, producing skin blisters along the way in a characteristic belt-like pattern that does not cross the midline in the front. Both shingles and the name of the virus zoster are from the Latin and Greek respectively for belt. The blistering rash can be intensely painful, leave scarring or discoloration behind, but usually disappears in a few weeks on its own. However, approximately 30 to 50% of people suffer post-herpetic neuralgia, persistent pain that can last for a year or more that sometimes can be debilitating. Usually it affects nerves around your trunk, but in 10 to 25% of cases it can erupt across your face, which can lead to permanent facial muscle weakness, hearing loss, or blindness. As if that's all not bad enough, having shingles as much as quintuples your odds of having a stroke over the subsequent few weeks, a risk that gradually declines over the following 6 to 12 months. It's surprising more people don't know about it, since the lifetime risk of shingles is 30%, meaning nearly 1 in 3 will get it sometime in their lives. Young adults only have about a 1 in 1,000 chance of getting it every year, whereas in older adults that climbs to closer to 1 in 100 each year. That comes out to 1 million cases of shingles every year in the United States. Thankfully, there is a shingles vaccine. The first became available in 2006 using a live weakened strain of the virus. The efficacy was only about 50% and couldn't be used in immunocompromised individuals, such as those with HIV, or on immunosuppressive drugs, such as many on chemotherapy. Thankfully, in 2017, a recombinant shingles vaccine was approved with a 90 to 97% efficacy for preventing an outbreak. It requires 2 separate injections, 2 to 6 months apart, and is expensive, like $280, but covered by Medicare and most private insurance plans. It also can cause transient systemic symptoms such as muscle aches, fatigue, headaches, or fever and chills, serious enough to interfere with everyday activities about 10% of the time. But the new vaccine is considered so much more effective that it's recommended for everyone starting at age 50, even if you were previously immunized with the old one. Given that the new vaccine is only about 5 years old, longer-term safety and efficacy data is still coming in, but so far so good. As soon as I turned 50, I lined up for mine.
Yeah, that was good, right? Hold on a second. Yeah, that was good. So any comments, I learned a lot reviewing this. The floor is open for comment question. Hi, Reverend Gary, nice to see you.
I didn't know that that if you had shingles within the 12-month period, you're at greater risk for a stroke. I never heard that before.
Yeah.
So
Yeah.
that's so informative.
There's some of that's some of like the side effect, the complication that could occur from it. Because you affect the nerve, it goes to the nerve pathway.
Right. So,
I have a question.
Go ahead.
I remember getting the vaccine, but for the life of me, I don't remember going twice. In other words, you get it once, and then what, a few months later you get the second one? Is that how it goes?
Hold on 1 second.
I too.
My dog is barking because there's someone at the door. So yeah. So you can, when was the last time you did blood work? Where did you get the vaccine? Do you remember?
It was last year. Okay, he answered my question. I'm going to go to my medic. No, I got it from Rite Aid, the vaccine. But I'm going to go to my medical doctor for a yearly checkup, so then I could find out, right? I guess.
So you can also go back to Rite Aid because they keep records, so they will be able to tell you if you got 2 or you got 1.
Thank you.
You're welcome.
Sherry, I had the vaccine too a while ago from Rite Aid, but I just one. I didn't have to go twice.
So I don't. How many years ago did you get the vaccine?
I can't even remember, but it's a while ago. About
so what? Do you know where you got it from?
6 years ago. No, I got it from Rite Aid, the same Rite Aid store I went to.
So I don't know if there was time they were giving 1 dose, but I didn't see anything in all the research that I did. I was 1 dose. I know they're 2 doses. So anybody else got it and got 2 doses or got just 1 dose? Anybody else?
I got none.
You got none. Okay, for those that came on late, Janice and Sister Mona Berry, we actually have I did a recording. I'll share the recording,
Okay,
but we
thank
should
you.
like really a nice video. Like towards the end of the presentation now, but I'll definitely share it with you because it's really great information. I'm gonna
Thank you.
put it to YouTube link and then I'll share it before the end of the day. Don't let me say that. Before the end of tomorrow.
Can you
Always.
send it to Sheila also,
Huh?
Dr. Sherry?
Say that again.
Sheila is asking how to get on. I
How
sent
to
her the
get
link.
on? The
but-
link is the
Yeah.
same link.
I know, I sent her, but she's not getting on.
Oh, that's weird. I don't know.
Can you send her the recording?
I'll send out the recording. I'll share the recording. So let me just finish the PowerPoint. Hold on.
Oh, the one thing that surprised me about the presentation is where shingles hides out when it's dormant.
Yeah.
In your spinal column,
Mm,
Huh?
in your spine, it said, right?
Yeah,
In your
in the
spinal
nerves,
column.
yeah.
yes.
Mhm. That's where it
That
hides. It
surprised me.
lays
I didn't know
dormant
that.
there. And then,
Yeah.
yeah. Oh, wow. People are just
Wow.
telling you what happened. It looked like I have to show that at least that video one more time. You know what? I'm
She
gonna
said
show that
no.
video, but that video is just 5 minutes. I'm gonna show it again for the benefit of those that are coming in, because this is really good information. Okay, welcome, guys. We're actually
Sheila.
rounding up, but I'm gonna show a video again. Hold on 1 second. I'm gonna replay the video that I showed earlier for the benefit of those that came in late. Those that were here early, I know you guys don't mind, right?
Mhm.
Sorry for the lateness.
No problem.
The more the merrier.
Yeah. And then when you see something more than once, it's clearer.
Yes, it's thick, yes.
Okay, so let's play it again. Okay.
Also known as herpes,
I'll start it from the beginning.
shingles, also known as herpes zoster, is a common condition characterized by nerve damage and a painful skin rash. It is caused by varicella zoster virus, the same virus that causes chickenpox. The first exposure to the virus, usually during childhood, leads to chickenpox. After the primary infection resolves, the virus moves to sensory ganglia of the spinal and cranial nerves, where it becomes inactive. The body's immunity against chickenpox suppresses viral replication, keeping it dormant for decades. Reactivation of the virus occurs when this immunity weakens and fails to contain the virus. This can happen as a result of aging, stress, or other diseases. Instead of another case of chickenpox, the reactivated virus causes shingles. It multiplies and spreads along the path of the infected nerve, resulting in damage and pain. The location of pain depends on the nerve that is affected. Because each spinal nerve supplies a specific area of the body called a dermatome, the patterns of pain follow the dermatome distribution. When a cranial nerve is infected, face pain results. As nerves come in pairs and usually only one is affected, the pain is typically limited to a small area on one side of the body. Shingles develops in 3 phases. Patients typically experience pain as the first symptom. The pain can be described as a stabbing pain or a burning, numbness, or tingling sensation. The area is sensitive to touch. Depending on the location, the pain can sometimes be mistaken for a lung, heart, or kidney problem. Less common symptoms include fatigue, headache, and fever. A painful skin rash appears in phase 2, a few days after the pain. The rash starts as small red dots, which develop into fluid-filled blisters. As the blisters follow the nerve path, they form a stripe on one side of the body. The blisters eventually dry out and crust over. The healing occurs in phase 3, which may take several weeks. There's no cure for shingles, but it is usually self-limited and resolves on its own. However, possible complications can be severe. Some patients may continue to experience debilitating pain beyond rash healing. in a condition known as post-herpetic neuralgia, PHN. The chance of developing PHN increases with age. Shingles that occur on the face, neck, or scalp may lead to vision loss, hearing loss, or other neurological problems. If blisters aren't properly treated, bacterial skin infections may develop. Prompt treatment with antiviral medications can speed up healing and reduce risk of complications. Pain can be managed with pain relievers, cool bath, or cool compresses. The affected area must be kept clean and covered. Most people get shingles only once, but it is possible to get it more than once. Shingles can be effectively prevented with vaccines. It is not possible to catch shingles from someone else, but people with shingles may spread the virus to those who never had chickenpox or chickenpox vaccine, in which case the person will get chickenpox, not shingles.
Okay, that is a summary of what we did, and I'm gonna share the rest of the slide that I was showing. So this is where we got to about the vaccination. So it's important for you to get vaccinated once you turn 50, and there are 2 doses of the vaccines. So if you have gotten your vaccine years ago and you don't remember whether you got 2 or 1, you can go to the same location. They can check the system to determine if you need another dose. Okay, so that's all about the shingles. Just want to talk a little bit about long COVID. I know we've been talking about long COVID, L-O-N-G, COVID, long, so because sometimes people think it's long, like L-U-N-G, no, long COVID. Long COVID can include a wide range of ongoing health problems, and this can last for weeks, months, or years. And this from after someone has COVID and they still find that they're still having the symptoms of COVID, even though they're not actively in a phase where they can infect other people. So it mostly occurs in people that had severe COVID-19 illnesses and have been sick with the virus. So people that are not vaccinated. So while most people with long COVID have evidence of infection, but some do not, but when they test, they will not test positive at times. So, but they still have the after effect of maybe being tired when they work or being having shortness of breath. So there's actually some help that can be gotten. There's some kind of treatment for this. So it's important if you feel like you're having shortness of breath, fatigue, brain fog, and headache, it is important to just reach out to your doctor and see if something can be done to support. Some of it may not be like treatment, but it may also be like therapeutic support, where there's also something I was reading up on that people can actually get what do you call disability if it's really severe. You can go on disability based on this. There's actually a ruling about this. So if you don't suffer in silence, if you're going through symptoms, and someone that is going through this, and if it can be proven that it is long COVID, they may be able to get some support in the community. Okay, so this flyer is about mask wearing. I know we're all getting tired of wearing masks. I am also, I feel your pain, but it's still important for us to be mindful that masks are still the effective tool to reduce not just COVID-19, other respiratory infection, flu, RSV, so COVID, the mask is really important, because when people cough, when they sneeze, when they sing, they project the droplets that could actually lead to infection. So to reduce the risk, especially when you're in mass transit or overly crowded New York City subway on the rush hour, you want to put on your mask. Because people are like in your face like this. That's why I hate taking the subway. I'd rather take the railroad. Sometimes railroad is crowded too at the night, but at least it's better than the subway. So you want to consider wearing your mask if you're at high risk for severe COVID-19 or you're around others who are. So also if you're sick and you're not feeling well, even if it's not COVID and you're going to be around people, I think it's something we should develop. you have upper respiratory infection and you're sneezing and coughing, and you're going out in a public area with a lot of people, you're coming to church, I'll just sit at the back and put my mask on. Because you want to not just protect yourself, you want to protect other people around you. Because if you get somebody sick, when you feel better, that person may get you sick again, right? So let's be mindful of that and wear high quality masks such as KN95, N95. They're the best that can protect you against COVID-19. And then this is just information about our next webinar. The next edition is going to be May 27, 2020, same time, same location. And if you guys have any topic you're interested in, you can let me know and then we'll make it happen. I think this shingles thing was interesting because I learned a lot while I was working on it. So thank you, everyone. Question, comments?
Thank you.
You said any
Yes,
topic. Do
Johnny
they have
said,
topics on menopause?
Monterey, what do you say for now?
Do you have topics on menopause?
Menopause, yes, that is interesting because I'm suffering from menopause now. That would be interesting.
Yes,
I'm gonna do a research
that
on
is
it.
so serious.
Yeah, I'm telling you. Thank you for bringing that up. I'm gonna do a research on it. So you have it. So next time we'll meet, we'll be talking on menopause.
Okay.
So we'll invite the men to come and listen to so they can know how to support their wives.
Well, don't they have something called menopause? It's probably not as severe as the menopause, but don't men? You ever heard of menopause?
I haven't, but it's something to look into.
Okay.
So
But
maybe
at least
we can sort of add it together and have a few slides for our men so they can feel motivated to come.
Right, or they could understand it a little more, instead of
Yeah.
being short patient. And I'm by myself, and I'm just saying for other people, for the husbands, what to understand what women go through, instead of just thinking, oh, she just want the window open, oh, she just want the window closed, oh, she want the cover off,
Because I would be like, the other day I was so hot and I just had to stop. Now what I do now, I stop myself, I ask, oh, are you hot? Are you cold? I ask people around me, before I start complaining that why is it so hot in here? And they're like, no, it's not hot. And yeah, so I just ask first, are you comfortable? Are you hot? And then they said, no, I'm not hot. That's okay. So I realize it's me, then I just take up a layer, get a cold water, try to walk around it. Yeah. Okay, so thank you everyone for joining us. If there are any questions, Sister Rosie, go ahead.
Is it possible just that for the COVID that short one, that little that you showed, is it possible you could put it on here so that we can just copy it so you don't have to call and bother you?
You mean the flyer?
No, the little video, the last one you showed. Can we get
Oh, you said COVID. You mean the one on shingles?
Shingles.
shingles? Yeah, the
Okay,
shingles.
I'll send it. I'll put the individual. I'm leaving my 7 and I'm gonna do that now. I'll put the individual. Or actually, you know what? I can put the link in the chat if that's what you want.
It's trouble for you.
It's okay. I actually have it in a notepad, so I just put it right here. Then I'll share the old video with you later. Yes, both of them are there. Yeah, it's in the chat. Both videos. So I'll give you a few minutes to download, click on it.
Oh, sure. It's not coming.